What is one of the biggest problems you have facing your laboratory today? If you think about it, hiring or training competent dental technicians has to be uppermost on your mind. How many times has a key technician left you? And you are faced with evenings and long weekends until you replace that key person. Then the quality is not the same nor consistent with what you were previously producing in your restorations. This video is designed to assist you in providing consistent, anatomically correct anterior anatomy with every restoration you deliver to your dentist. Through the use of the Upper Anterior Wax Shell Kit from Glidewell Direct, you will greatly reduce production costs and allow any experienced level of technician to complete a case with repeatable quality and function. The prefabricated Anterior Wax Shell Kit contains a wax pattern for maxillary anterior teeth in 3 different sizes to meet every smile proportion. The kit provides the 6 anterior teeth consisting of the upper centrals, the laterals, and the canines, or tooth numbers 6, 7, 8, 9, 10, and 11. Each of these anterior tooth shells comes in 3 sizes to choose from: small, medium, and large. Included in each wax shell kit is a measuring tool and the size chart to measure each tooth on the model. We will start by looking at diagnostic wax-ups. Check the model to see if there is any issues with the occlusion. Open up the model to make sure there is no debris or bubbles on the occlusal surface. Measure each tooth of the unprepared model with a measuring device included in your kit. We will be using the measuring tool and the dimension chart to determine the size for our model. Here we can see that the approximate tooth length is 9.6 millimeters and the approximate width is 11 millimeters, which means we will use the large-sized shells. Place the kit aside. Prepare the model as you normally would. Here we have prepped 6 upper anterior teeth. Place the opposing model back to see if there is enough occlusal clearance. After the clearance has been verified, place the models back in the case and begin placing the anterior wax shells onto the bench. Prepare the model by adding some support wax around the prepped abutments. Now start placing the correct size shells for the centrals onto the model. When placing the shells onto the model, we need to remember some basic anterior setup guidelines to achieve ideal aesthetics. In order to visualize this concept, first establish 2 lines of reference. The first is the midline, an imaginary line running between the upper centrals. The second is a horizontal axis, an imaginary line running at a right angle to the midline that approximates the position of the upper anterior incisal edges. From the midline, these anterior teeth need to have 2 to 7 degrees of mesial inclination. When placing the laterals, remember to place laterals about 1 millimeter above this horizontal axis. On the other hand, both the centrals and the cuspids should sit directly on the horizontal axis. Add wax to the lingual area and add lingual anatomy. Add additional wax to the margin of the shells to fill in any open spaces. Carve out any remaining wax around the margin. This case is now complete. As you can see, the entire diagnostic wax-up procedure only took a few minutes using these preformed shells. Now let's move on to our next case. Now let's look at how anterior wax shells can be used for a 6-unit pressed-to-metal case. Before preparing the model, we will measure the size of each tooth on the solid model, as shown before, to determine the appropriate wax shell size. Again, we use the measurement tool enclosed in the kit and the size chart located on the inside of the case to determine the ideal shell size for this case. With the help of sticky wax, place anterior shells onto each of the non-precious copings. Verify the correct placement of these two centrals by closing the articulator. Continue to place the rest of the anterior shells. Remember the aesthetic placement rule that we talked about earlier. Now, fill in the lingual area with wax. Fill in the margin area with white wax. Carve out any excessive wax around the margin. Adjust the incisal edge and the lingual area. The case is now ready for pressing. Follow the porcelain manufacturer's instructions when pressing to non-precious metal. After the porcelain is pressed, cut off the sprue and begin placement of each crown onto a die. Use the red articulation tape to check for tight contacts and adjust accordingly. Now check for occlusal contact and adjust the red marks. Stain the restoration as you normally would. And check the shade with a shade tab. If necessary, you can enhance the translucency with a blue stain. Now place the restorations into the furnace. Refer to your porcelain manufacturer's temperature guidelines when firing. After the firing, let the restoration cool for a few minutes. When the restorations are cooled off completely, place each unit onto the model. This case is now complete. As you can see, this anterior wax shell can be used for any pressable ceramic case, as well as all ceramic copings such as zirconia . The Anterior Wax Shell Kit can also be used for a non-prep veneer case. Dentists are adding no preparation veneers to their restorative options, in addition to conventional prepped veneers. No prep procedures differ greatly from normal crown and bridge and ceramic model preparations. Each case received for no prep restorations must be carefully inspected to determine whether undercuts, voids, or lack of occlusion are too great to successfully complete a restoration using the anterior wax shells. Establishing gingival margins for no preparation veneers are different than from traditionally prepared restorations. We will start this no preparation case by pouring the impression with improved dye stone material. After the dye is separated from the impression, trim the gingival area until it exposes the margin with either a number 8 round burr or a carbide burr, and carefully mark the margins with a red lead pencil. Next, apply dye hardener to seal the margins. This ensures that the margin will not be erased and prevents the stone from being chipped away. If there is an undercut like the one seen here, we will use Adsit base to fill in this void. Fill in the void with the Adsit base. You'll want to spray a small amount of Zap-It to the surface to speed up drying time. If there are any sharp edges, especially on the incisal edges of the central and lateral incisors, you can apply rubber separator to smooth out the edges and to prevent the veneers from fracturing on these sharp surfaces when seating in the mouth. Be sure to apply a small amount so that you do not distort the interior aspects of the anteriors. Now apply the rubber separator to the affected area. Make sure not to apply over the marked margin. With this case, the material is applied from incisal to incisal edge of the centrals. After measuring the model with the measurement tool, we see that medium-sized wax shells were selected. Next, apply dye lubricant to the surfaces of each tooth on the model that you wish to restore. If you do not apply the dye lubricant, we may have trouble attempting to separate the shell from the dye later. Apply the dye lubricant liberally to the designated areas. Dab the excess lubricant with a tissue so that the shell will adapt ideally to the surface of each tooth. Make sure that there are no puddles between the teeth. After cleaning off any excess lubricant from the dye, place the dye under the muffle of the furnace and preheat the model for about 5 minutes at 1200 degrees Fahrenheit. While the model is preheating under the furnace, it is important to get all of the anterior wax shells ready. Once the model is taken out of the oven, begin placement of the shells right away to achieve a good adaptation while the model is still warm. After 5 minutes, take the model out of the base of the oven to start the placement of anterior shells. Close the lid on the kit and set it aside. We will now open the wax pot to complete the waxing procedure. Apply warm wax to the model. Apply the wax to each tooth to ensure good adaptation. Start by placing a number 9 shell onto the number 9 central incisor. Apply a slight pressure until the shell adheres and adapts to the incisor. Now place the lateral incisor shell next to the central shell. Be sure that when placing the lateral, it does not displace the adjacent central. Continue this procedure with the rest of the teeth to be restored on the model. Once all the shells have been placed, go back to each of the shells and check its adaptability. Remove any excess brushing wax around the interproximal and lingual areas with a carving instrument. Using green wax, start filling in the margin area around the wax shell with a hot wax pen. Fill in the incisal edges as well. With a wax carving instrument, clean up any excess green margin wax around each tooth. Next, attach a sprue to each wax shell. An ideal sprue length is 8 mm. When determining placement of the sprue, be sure to place it on the incisal third of each tooth and not on the incisal edge. The thinnest area should be a minimum of 0.3 mm. Then attach the sprued shell to the wax former. The shells should angle towards the outside of the ring with the margins directed towards the outer walls. Select a 100-gram envelope of MicroStar or PicoVest investment. Shake the package until all of the investment is at the bottom. Cut the top of the investment packet and set aside for now. Using an investment liquid measuring vial, mix 20 milliliters of special liquid with 5 milliliters of distilled water. This is an 80% special liquid to 20% distilled water ratio. Add the liquid to the powder and mix for the time period specified in the manufacturer's instructions. Pick up a small amount of investment on your brush and place it at the gingival area. Allow the investment to flow down into the incisal edge area so that it does not trap air bubbles. Continue pouring from the bottom of the investment ring up to the top and allow it to sit. Allow the investment to stand for at least 17 minutes. After the investment has hardened, remove the sprue former and the ring. Place the investment ring into a preheated oven at 1652 degrees Fahrenheit and hold it at that temperature for 45 minutes for one ring. If additional rings are placed into the oven, add 10 minutes hold time for each ring. Do not place the ingots or the ceramic plunger into the furnace with the ring. When placing the ingots and ceramic plungers aside in preparation for the pressing, blow them off. and place them in a clean area so that dirt or debris is not incorporated into the restoration. When proper hold time has been completed, remove the investment ring from the burnout oven and quickly place the required number of shaded ingots into the sprued hole. Place the plunger into the sprue hole and push the button to begin pressing of the anterior wax shells. Allow the pressed investment ring to completely cool to the touch before moving on to the devesting procedure. Sandblast the investment approximately halfway down from the top. Use 25 micron glass beads. After the anterior veneers have been sandblasted, visually examine the veneers to check for a complete casting and to ensure that the margins are ideal. Before beginning the next procedure, prepare a bowl of water with a sponge inside. Cut each sprue with a contour stone. Get close to the labial surfaces of the veneers when cutting so that unnecessary adjustment around this area can be minimized later. Warning, keep the veneer wet by constantly dipping into the water. Failure to do this will create heat-generated fractures, and the veneers will have to be remade. Now check each veneer on the model for an accurate fit. Ensure that there is no debris that may prevent the veneers from fitting properly. Using an SH2 greenstone, start adjusting the area on the labial side of the veneer. Because this will be a one-step procedure, apply the glazing medium mixed with the glazed powder onto the veneer before staining. Apply body stain to the veneer. Start with the lower third ending at the gingival level. Make sure that the application is nice and even. As the stain comes toward the incisal, it needs to be thinned out. If you see a puddle of stain at this stage, make sure to diffuse it. Otherwise, the stain may look too bright after firing. If necessary, bring blue stain to the incisal edge of the restoration to enhance incisal translucency. Compare this veneer with your shade guide to check for the accuracy of the prescribed shade. When the shade matches, place the veneer on the honeycomb firing tray using a hemostat. Make sure there is no sticky wax on the back of the veneer during this procedure. Repeat the procedure on the rest of the veneers. After all of the veneers have been stained, place the honeycomb firing tray in the oven for 2 to 3 minutes at 770 degrees Fahrenheit with no vacuum and no holding time. Place the honeycomb on the bench and begin checking the veneers on the model for accurate fit onto the die. Here we can see that all of the veneers fit onto the die and fabrication of the restorations has been successful. Etch the veneers with Gresco Ceram-Etch for 5 minutes. Warning, always wear a face mask and rubber gloves when using any acid in any form. Etching material contains an acid, therefore all etching of restorations requires safety equipment. Place each veneer in the customized veneer case or a veneer case of your choice. The case is now ready for delivery to the doctor. The use of anterior wax shells from Glidewell Direct will increase your profit margin by greatly reducing production costs. It will provide your dentist with consistent, natural anatomy, and it will allow technicians of any skill level to complete any restoration easily and quickly.